Welcome back to Alberta Live here on fusedlogicTV. I'm your host, Walter Schwabe. I'm here with Doug Griffiths. Doug, before the break, we were talking about trust and leadership and scandal and all of those kinds of things. I want to shift to what I believe is another scandal in this province, and that's the level of health care that we're getting based on all the money, the quality, based on all the money we're throwing at it. I've got my stepdad is needed a hip replacement for what seems to be forever, especially if you're him and in his pain. The 5-year action plan was supposed to say that hip and knee replacement surgeries, the wait times down to 6 months or less. He's been easily over a year. And what I understand is that the specialists in that hip and knee clinic here in Edmonton, they only get 2 days a month to have surgery time. They're only able to do 8 hours a day of surgery. So how, and the rest of the surgery facilities are dark. So is this a manipulation behind the scenes that most Albertans don't know about what's going on? We've got this shiny new, clinic making it look like we're getting something done. But in the reality behind the scenes, this stuff isn't happening. So in your administration, you take over. How do you fix healthcare? And talking about wait times and the action plan and that, how do you fix it?
Oh, there's so many things to do in healthcare. I've advocated changing the way that we fund hospitals and utilizing health professionals to the full scope of practice are a couple of things I've been calling for 9 years. And but things like that, where you've got surgical rooms that are dark and a list that says you can only do 2 surgeries a week. The best way to fix it is to shine a light on it so that everybody in Alberta gets to see what happens. Because as much as people think that there's politics at the legislature, there's politics in healthcare, and we're not always the ones that are doing the politics. You've got to get rid of some of the games and the politics to keep things bogged down, because we still spend more per capita than any other jurisdiction in Canada and getting below average results. And so there's got to be stuff in the system that needs to be fixed.
Right.
And the problem is, it all sort of remains in dark corners and nobody talks about it. Shine a light on it. Open this stuff up and let Albertans start to discuss it. It's all part of open government again, where you open it up and say, here's the problem, here's the data we've got, here's the situation. Anybody got any creative ideas?
Well, okay, so that's interesting, because the last guy who did that, right, got kicked out, is now the leader of an opposition party, and he did precisely that. He was, at least, I think the perspective of many Albertans was he was trying to shine a light on what he thought was wrong, not only from a physician's perspective, but also from being on the inside, being a sort of on the deputy side of this. So what happened? Is because you become premier, is that kind of stuff behind the scenes in cabinet going to go away?
Oh yeah. We're going to move to open debates in the legislature, which will make free votes meaningful in the legislature. I did have one of the editorial boards I met with in the last couple of days ask me how I was going to distinguish myself and set myself apart from Raj Sherman on health policy. I told them, that's old politics. Why do I have to be different from Raj Sherman? If we come up with a solution collectively together, the New Democrats, the Liberals, the Alberta Party, the Wild Rose, and the PC Party, hallelujah.
Right.
Albertans should be screaming, thank you, we finally fixed it. Exactly. And that's what this is about, is getting better health care to Albertans, not playing political trump cards so that we can keep power.
So then you, as Premier, would be less into partisan politics and putting up walls and doing that kind of thing, much more collaborative.
I've said for 10 years, if you ask, I think the New Democrats, the Liberals, even the Wild Rose in the House will say that I'm one of the MLAs that's less partisan, and I don't oppose their ideas because they're their ideas. I've always said my generation, the next generation, our generation is much more inclined to want to discuss ideas than fight about ideology. We don't care who gets to be. We don't think the right is right and the left is wrong or anything like that. We just want good ideas so that we can get on with our lives.
Right, exactly.
And I think it's not just Alberta. It's all across North America that you're going to see a transition and a change from ideological politics to idea-based politics.
We've got another question from the chat room. Go ahead, Evan. Let us know what it is.
Longtime viewer Rick Newcomb asks, how would or could we design a system that holds union healthcare workers accountable for their level of service to patients?
That's a good question, and much more complex than probably the answer I'm going to give. The first, look, conservatives, I always say, but it doesn't matter if you're Liberal or New Democrat. I still think every Albertan values getting paying for what you get and getting what you pay for. And so performance measures, I've worked on public accounts, and performance measures are one of the most valuable tools to ensure that we're getting a return on the investment that we make. How else are you going to make sure that you're getting value for your dollar from every health professional, from our educate, unless you know you're getting a return on your investment? So you need performance measures to check everybody's performance. And I think that's one way that can help. But we shouldn't assume that we're not getting.
You get performance measures. You're going to get resistance from the unions on that.
I don't think so. No? I don't think so. No. I mean, you might get a few just because you mentioned the word performance measures, and then they worry about merit pay. But that's not the intention. The intention isn't to attack an individual and say, "Wait a second, you didn't earn your pay." The idea is more so, wait, we're not utilizing you to your fullest capability or fullest extent, to the fullest scope of practice that health professionals can be utilized to. And that's what it is, to make sure we're getting the best performance out of each individual. It's not meant to hold individuals to account so you can lay them off or fire them if they didn't meet their targets, performance targets.
People always go negative all the time, right? I mean, just think positively, right? Yeah. Okay, so we've got there's another question coming on from Twitter. Jonathan would like to know what you think of Stephen Duckett's letter to the Premier-elect, which he just released regarding healthcare and how healthcare should go. Have you seen the letter?
No, I haven't. I have to apologize. I've been in meeting after meeting since 6:30 this morning, and I haven't seen it. I did hear somebody told me the comment that there was some mention of taking politics out of healthcare, which I can agree with. If you can, it's difficult because you take politicians out of healthcare, and people get mad at the politicians because they're not making political decisions for Albertans. You get politicians in there, and then people are mad because politicians are in there making political decisions. It's
double-edged sword. Right?
Yeah, and the reason why it's like that is because what issue is more critical to people than their own healthcare in their lives? So it becomes a very emotional issue, and I still think that we need to back up and change the culture of healthcare and reevaluate exactly what it is we're trying to accomplish.
Well, I skimmed the letter quickly, and he kind of makes the 3 points that stuck out for me were that he said to stick with a centralized structure, right? Not go back to the health regions. Do you agree with that or disagree?
Well, now that's a political answer to say yes and no. I think we still need the provincial model for provincial services like cancer treatment and some of the major surgeries and electronic health records. But I still think we could do better to have more local input and control on healthcare. I mean, in the city of Edmonton, for instance, or the city of Calgary or Lethbridge, or if you have some local people integrating the paramedics with the ambulance and the emergency room and the regular beds and right through the long-term care beds and seniors health and home care, you can get a better integration of health services and utilize health professionals to their full scope of practice and make sure that you're still addressing community needs more than if somebody in a corporate office that may have never been to your town or your city making decisions can make. So I still think there's a blending that needs to happen.
There's been some discussion, and then he brought it up again in his letter, was that the Grand Prairie does not need a new hospital site and a whole brand new shiny building. That he doesn't say this, but I've extracted that upgrading of the existing facility and modernizing it would be the better result. The PCs often get criticized for just putting up a new school here, so we've got a ribbon cutting. Meanwhile, this school is being shut down, teachers being laid off over here. So it's kind of like the shell game. With respect to the Grand Prairie Hospital, should they get one, a new one? Should they not? What do you think?
Well, I don't know the exact scenario and situation. I haven't seen the old hospital or the report that analyzed it, or whether or not they need a new one based on demand and need. All I know is that we do have a problem in this province with a tendency to centralize everything, and we don't need to centralize everything. We wind up with surgeons all being at one hospital, and we don't have enough operating rooms for them, so we get backlogs and lists. We have a lot of capacity around rural Alberta that we could utilize. Now, that said, when you're talking about expanding capacity and making sure that we're utilizing all the space that we have, perhaps there is an opportunity in Grand Prairie to build a new, larger hospital that draws new physicians out and helps relieve the waiting list. I'm always hesitant to somebody who thinks that we should just centralize services more. I think Peter Lougheed's comment, I read this quite a while ago, what is sent to me, in his last year as Premier, said something to the effect of, the province has evolved and developed very well. But we have to be careful that we don't just concentrate everything in 2 centers. We need to make sure that we have 20 Red Deers and 40 Drumhellers and 100 Stettlers. And now I think I'm putting in my own community since I know that area. But at moving services around so that we don't, otherwise we just drive up the cost because we're all centralized and everyone's competing for the same space and everything goes up. And I don't know that necessarily has served us well all of the time.
Just if you just tuned in here to FuseLogic TV and Alberta Live, we're going to take a quick break. Stick with us. When we come back from the break, we're going to ask Doug about some finances. Stay tuned.